When I heard, does wellness include cancer risk reduction measures, my first thought was, well, no, but really thinking about that, that's not true. It absolutely does. And I think it particularly does almost from that global health, that population health perspective. So it particularly includes risk reduction measures when you think about living a healthy life. So we all understand that there are relationships between how we live our life and how our health is impacted. And certainly post-treatment there, I think there's quite emerging evidence around, the impact of good diet and exercise and sleep, effective sleep, and mental well-being or psychological well-being can really, that overall health definitely has a positive impact on risk reduction. I don't know that you can you can never make a link between what you do individually and your cancer journey. So it's not, well, I didn't eat any sugar and I was vegetarian and therefore my cancer won't come back. It doesn't work that way. But there's certainly population health. The healthier we are, the less likely potentially on some levels that it may come back. But it depends on your cancer. It depends on, many factors. And we don't know, the links are not completely causal. We just know that as a general rule, we have a greater chance of improving reducing the risk of cancer coming back when we have a healthier environment in our bodies and our emotions. But I think, again, because it's nothing causal, then it can be a really real mind game. And so to be really careful that we don't judge ourselves heavily. We need to live quality of life. We need to consider what we're alive for, which is participating in relationships, in the things that we love. We're here for, we shouldn't be shutting down the things that really matter to us. I guess I sought a bit of information from our prostate cancer nurse around this, not having an expertise in bladder cancer in particular. And, she kind of spoke to me about it, it being it's a more rare cancer. So I think that makes the experience more difficult on some levels. I think anyone with a cancer, in some ways, any woman with a cancer that's not breast, people assume if you say you have cancer, it's breast cancer. There are certain cancers that almost have a known support structure for, and bladder cancer is one without that. So I think in some ways it's even more important that that people going through bladder cancer can tap into supports, because it's not commonly spoken about, and so it's really important that there's an opportunity to see other people either with bladder cancer or cancer, and to really be part of that social experience of speaking to people who have gone through something similar. So I think that peer relationship is quite important, particularly in some of the rarer cancers. And like all cancer, it's an incredibly defining moment in your life. It comes generally for most people as almost an assault. It's your life changes. You remember that moment forever, and it's a time when you will have treatment that has I would say does damage to your body. There's pretty much no cancer treatment that only affects the cancer. It's not generally particular. It has other things that it does. It's not a nice and easy treatment, and so anyone who's gone through that would benefit, I guess, may benefit from support, whether that's psychological support, whether that's peer-to-peer support in a support group style, whether that's exercise, whether that's art therapy, music therapy, whatever it may be. Wellness is a range of, as I said earlier, so wellness activities aren't one nice linear pathway of, day one you start with this, and, the best time is at diagnosis. And, it depends on the individual. It depends on the burden of treatment as well in terms of what can fit in. Often people find that, this is, I guess, through patient stories, is that there are a lot of people who through their treatment, they just want to do the one foot in front of the other, and then they want to look at almost the other, which, you could consider wellness a bit of the other post-treatment, once they've had a chance to just, they don't want to focus on anything but what they need to do next. And that's completely reasonable. Other people might feel that through their treatment, they really need the extra support to get, or they, that they want that to go alongside in order to get through that stage more effectively. So it does depend on the person. Sometimes people say that carers or family tend to almost want that psychological support through the treatment, and that the person with cancer wants it after, because they have put things on hold. But it absolutely depends on the person. There are certain things that are, there are certain programs that are designed for particular stages. So the Cancer Council runs what they call, well, they've changed its name a number of times, but it's essentially a post-treatment wellness program. So there are certain things that are that have almost been set in that way. But, we have a lot of patients going through radiotherapy who see our massage therapists, and who then might, go from that to trying art therapy or music therapy, or, there's multiple things through multiple stages, and there's no right time. It's probably a matter of really making sure that you think about whether it's going to help you, and you think, for many people, it is an opportunity to try something. It's such a change for people's lives that sometimes it does mean you think outside of how you've normally done things. And so trying something new can actually, it almost can be an opening experience. And I'm not saying that it's a positive thing to get cancer, but it can certainly shift the way you live your life and the way you consider what you might do. Wellness is something that you can do in any way, really. It's very personal and individual. There are wellness groups, there are wellness apps, there are wellness, you can journal, and that can be a wellness activity. You can journal with support, or you can journal by yourself in a really, some people have that absolute ability to tap into that and follow those activities. Other people really, crave the structure or crave the social. In many ways, wellness centres, some of the things that they provide are the beauty of the space, and the fact that within a hospital setting you have a non-clinical space. So, when you're not at a hospital in the first place, it's non-clinical. So absolutely wellness can occur outside of hospitals, and it absolutely does not need to be within a defined program. It's very much around going, what would support me in this moment, or what might support me heading into my future. Certainly what we try and do in the hospital setting is make sure that our wellness activities are as evidence-based as possible. Things have been vetted. We don't have practices that are unsafe. We don't have practitioners that may be saying things that are unsafe. And certainly at the ONJ Centre, we work very hard to make sure every wellness activity is free for our patients. So, they can get massages with someone who's trained in oncology massage, so understands all the contraindications around massaging someone with, say, a solid tumour, so they know how to position, they know what they can and can't do, and they can receive that for free. But that's not to say, most massage therapists that you see, you fill in a form that says you have cancer. As long as you know what can and can't be done, and you've potentially sought that information from your doctor before you, say, go and see someone that might be outside of the hospital setting and therefore doesn't have your history, as long as you know and you are clear about sharing your medical condition and knowing some of those elements, then absolutely outside of a hospital setting. I would start by saying, to make this attractive to older men, I think the first step is not to assume that it's not. The first step is not to assume that it's only women, middle-aged women, who participate in wellness activities, because we're in that assumption. Then we almost naturally market towards that, or naturally only mention it to that patient group if we're a clinician, because we don't want to, annoy someone with something they don't think is reasonable. So I think the important thing to start with is not to assume that someone is not interested in a wellness activity or in a supportive care offering based on their age or gender. I think the other thing, so when we do, I guess, think about some activities within wellness that might match older men, then certainly I think the introduction of exercise across kind of traditional cancer care is increasing in every hospital, I think, at differing stages, public and private. And exercise can be a great way of tapping into men's experiences or activities that they want to participate in. And and this is from women, I've certainly heard that exercising within a group of people so it's a cancer exercise group, they have individualised programs, but it's being run in a gym together, has been the best support group people have ever found, because there's something about it being an activity-based group rather than just defined as a support group that actually then takes that, that communication ownership, shifts that communication space where you don't have to go in there going, I'm here to share my emotions. Is this something I really feel comfortable with? You go in there for that activity. Within that activity space, the conversations, the opening up, the actual true support around people achieving their goals, because it's almost goal-oriented, it almost lends itself to a supportive experience, has ended up being one of the most powerful. People have described it as a support group, even though that was almost an incidental element. So I think tapping into things like exercise can be a really useful way of bringing people in who don't want to talk about feelings and who don't want this to be what they don't believe that what they need is support as such. I think also, there's so many, a time in your life when you have something that is such a sudden change is sometimes a time that you try something new. You can try music therapy. There's very few people who don't enjoy music. A good music therapist or a good music group will tap into your interest. And same with something like art therapy, where it's around, potentially trying something new, expressing what you are going through in a different way without having to do a talking therapy, can actually be incredibly powerful. And a lot of the people that get the most out of it are the ones who've never done it before, because it's a completely new expression. I guess cancer doesn't begin and end with your treatment. That post-cancer time, what in health professionals terms we call survivorship, is a really big part of your experience, and to be really kind to yourself within that and be aware that you are, whether you have any cancer left in your body, you are living with the experience, and that can be, a fear of cancer recurrence, experience that's very, very real, or your body recovering, your sleep starting to get back to normal or not. I think being around peers, I think so the peer support groups can be crucially important, that are often run not through wellness centres, they're often run through peers. So don't be afraid to give one a try. Don't be afraid to start one, I think that's important, because there's probably very few people who understand that the experience of going through cancer isn't just the medical experience. It's the fact that you've lost. It feels like you've lost privacy. Suddenly, people feel that they can give you advice without you asking for it, or can say things that can be, and being able to actually have that conversation with people that. Rather than just your family and friends, who might be the ones that are actually not helpful, even though they're coming from care.